At the Vertrae Surgery Center in Dayton, Ohio, neurosurgeon Dr. Kamal Woods helps patients navigate the really complex world of chronic pain. And he often sees people who have heard this term neuromodulation, but have never been given a clear explanation of what it actually is. So today, we're going to break down his simple framework for understanding these advanced therapies.
So let me ask you, are you one of the millions of people living with chronic pain? And maybe you've heard the term neuromodulation from a doctor or you've seen it online, but you're still not quite sure what it really means? Well, if that sounds like you are definitely not alone.
In fact, Dr. Woods sees this exact scenario play out every single week. Patients come in, and their chronic pain just hasn't responded to conservative care, and they're understandably confused about what advanced options are even available, let alone which one might be right for them.
Okay, let's dive right into this. At its core, neuromodulation is a category of therapies. They use implanted electrical devices to treat chronic pain that just hasn't gotten better with other treatments. But here is the most crucial point. It's not just one thing.
And this is where Dr. Woods' framework brings so much clarity. He organizes neuromodulation into 3 distinct families, each one built for a different kind of pain. There's spinal cord stimulation, or SCS, dorsal root ganglion stimulation, or DRGS, and a restorative therapy called ReActiv8.
So let's break down these 3 families. The key takeaway here is that this isn't about which device is best. It's about matching the right therapy to the specific type of pain a patient is actually experiencing.
First, let's imagine a patient. Picture someone with a diffuse, burning, electrical-type pain that runs from their low back down one or maybe both legs. This often happens after a previous back surgery. The pain is widespread, not just in one specific spot.
This classic pattern of widespread neuropathic pain points directly toward the spinal cord stimulation, or SCS, family. SCS works by delivering gentle electrical signals to the spinal cord itself, and that essentially modulates or scrambles the pain message as it travels up to the brain.
Now, let's consider a completely different patient. Maybe their foot became just incredibly sensitive and painful after an injury that should have healed a long time ago. This is a condition known as complex regional pain syndrome, or CRPS. Their pain is intense, for sure, but it's highly focused in one specific area.
This kind of highly localized, territory-specific pain points toward dorsal root ganglion stimulation, or DRGS. See, instead of stimulating the whole spinal cord, DRGS targets the specific cluster of nerve cells, the dorsal root ganglion, that's responsible for that single painful area. It's a much more precise intervention.
And finally, a third type of patient. Their pain is a deep ache, right in the low back itself, with no significant pain going down the leg. It gets worse with activity, like sitting or standing, but it feels a lot better when they lie down. This is what's known as mechanical pain. This mechanical pain profile points toward an entirely different therapy called ReActiv8. And this is where things get really, really interesting, because ReActiv8 works on a completely different principle.
Yeah, this really highlights the fundamental difference. While SCS and DRGs basically turn down the volume on pain signals going to the brain, ReActiv8 doesn't mask pain at all. Instead, it's a restorative therapy that actually retrains a key stabilizing muscle in the spine, treating the mechanical cause of the pain right at its source.
So, if one of these families seems to fit, how do you know if the therapy will actually work for you before committing to a permanent implant? This is a crucial question, right? And the whole process is designed to provide a very clear answer.
For SCS and DRGS, patients get to undergo a temporary trial period. It's usually for about 5 to 7 days. They literally get to test drive the therapy in their real life to see if it provides meaningful relief. For ReActiv8, the pathway is different. Candidacy is determined through a detailed clinical assessment and imaging before a single procedure. Either way, you get an answer.
But it is so critical to understand that these therapies are not for every person who has chronic pain. Success isn't just about the technology, it's all about precision and very careful patient selection.
Dr. Woods is very clear on this. He says, these are precision tools. Patient selection determines outcomes. This honest, patient-centered way of framing it is right at the heart of the evaluation process. Let's look at a powerful example. In the landmark clinical trial for DRGS, the success rate for patients with CRPS was an impressive 81.2%. But this illustrates the point about selection perfectly. An 81% success rate also means that for nearly 1 out of every 5 patients in that study, it didn't provide the relief they needed. This is why matching the right therapy to the right patient after a thorough evaluation is absolutely everything.
And this brings us to the ultimate purpose of a consultation at a specialized center like Vertrae. The goal isn't necessarily to get a procedure. The goal is to get a clear answer.
So, after all this, how can you begin to know which family might fit your specific pain? Let's try to put it all together in a simple guide.
Okay, as a general orientation, if your pain is widespread and has that burning quality, you can think SCS family. If it's focal and burning in one specific territory, think DRGS. And if it's a deep, mechanical low back pain that gets worse with activity, think ReActiv8. But please remember, this is just a guide. A full clinical evaluation is what provides the real answer.
And that really brings us to the most important takeaway of all. During an evaluation, Dr. Woods is direct. If a different direction, maybe not neuromodulation at all, better fits the clinical picture, he'll say so, because getting a clear, honest answer, whether it's a yes or a no, well, that is the true and legitimate outcome of the consultation.